very much. So let me formally welcome you to this Q&A session. It's great to see familiar faces and some new faces as well. So we had a session, as you all know, where our three panelists, Cllr Abigail Marshall-Ketung, Dr. Mathias Chinyandura, and Xina Broderick, took us through COVID-19, and it was great because we're looking at it from various lenses, social, medical, and looking at the bereavement side of things, which was amazing. So people found it informative, but we didn't have enough time for question and answers. Now, since then, it looks like we started an avalanche of webinars because there have been so many webinars on COVID-19 and the BAME communities. So this is going to be a Q&A session for us to just explore a little bit more about how we are affected by this. However, before we start that, I would like to wish you all, okay, someone stop my video.
No, sorry.
Okay, stop my video. Okay.
Accidental.
That's fine. And now it's gone blank. Can you all see me?
We can hear you.
Yeah, I can't see anyone or hear anyone. No, I can hear you, but I can't see you.
We can hear you now.
We can hear you.
Okay.
Yeah.
Right. So I was going to wish you all a happy Africa Day. So today is 25th of May. And it's Africa Day. This is so awesome to be here. I am so proud to be African. I wouldn't want to be anything else. And I know most of you feel the same way as well. It's a cradle of mankind. So arguably, all of us, regardless of the color of our skin, come from the same place. So Africa is a motherland for all of us. So it's great because with this pandemic, COVID-19 has really brought us together. We've seen so much cohesion in our communities here in the UK and also back home. And there's a definite reawakening of Pan-Africanism. And this is why you can see so many faces today from different parts of Africa and indeed different parts of the world. So there's a former AU ambassador who I am sure you have seen her videos time and time again, Dr. Rikana Chihombo-Rikwao, and she's really been calling for us in the diaspora to do more. We are in such privileged position to help our communities here grow, but to have a really huge impact on the African continent and in the Caribbean as well. So the role of the diaspora is invaluable, and this is why in this particular session, we want it to be both informative and solutions focused. We don't want to always be asking or begging for solutions. We are educated, learned people. We have great resources both here and at home. Bring them together to start providing solutions to our own people. So that is the spirit of Ubuntu and the spirit with which we are going to have our webinar today. So Sam, the next slide. I just want to remind you all basically that we are recording this. So if you don't want to be seen, feel free to get yourself off camera. And when you put your comments as well, just be mindful because some of those will be seen as well. So thank you for joining us. Now, I'll go straight to the reason why we are here. And I will start by drawing your attention to our panelists. So we've got three main panelists who we had last time, as I said, Dr. Mathias Chinyandura, Xina Broderick, and Cllr Abigail Marshall-Ketung. But joining us today is Dr. Patricia Mbithe-Mutunga. And Dr. Patricia, she will introduce herself, but there's been a lot of talk about risk assessment, and she'll be able to shed a lot of light on that. Now, we also have with us Councillor Hannah Bithell. So Hannah has come in as a participant, but it would be great if Hannah can also just add a word here and a word there, because she is a teacher by profession, and she is a lead member for the LGBTQ+ at the Council. So she's well versed with diversity and inclusion. She's also on the same committee with Councillor Abigail Marshall. This is a committee that is headed by Councillor Jonathan Pryor, who some of you might have seen on the BBC quite recently. And this is the Learning, Skills, Employment and Equality Committee. So we are all talking about going back to school, kids being allowed back to school and that kind of thing. So both she and Councillor Abigail will be able to shed light on that. So welcome, Hannah. So I will just give the panelists a couple of minutes to just quickly reintroduce themselves to us. So we will start with Dr. Mathias Chinyandura. Can you please introduce yourself to our participants?
Hello, thanks very much, Dr. Kendi. So I'm Mathias Chinyandura. I work for Leeds Teaching Hospitals. I'm a consultant anaesthetist. I also work as senior lecturer for the University of Leeds. Thank you for inviting me. I would just want to just correct, I think on the video I'm coming up as Lucy Ndlovu, as you can see, but I'm not Lucy. That was just a technical glitch that we had, but yeah, sorry.
Good to know. Right, thank you, Doc. And so Xina, if you could please introduce yourself to us. Thank you. Yep. Oh, we can't hear you. You're on mute.
Ah, thank you, Sam. Hi, my name is Xina Broderick. I am one of the owners of Gooding Funeral Services, which I own with my husband, Peter, and my sister, Gay. I came on last time to talk about the effects that COVID has had in the BAME community in my professional capacity, and also because I've actually had COVID-19 along with my husband and my sister and two of our sons and my brother-in-law as well. So last time I was able to talk a little bit about what that experience was like. I'm aware that we weren't able to answer as many questions as the audience would have liked last time, so I'm here to answer any questions that you might have. Thanks for inviting me.
Fantastic, thank you. And now Councillor Abigail Marshall-Katun. We can't hear you. We can't hear you. Oh.
Can you hear me now?
Yes.
Good afternoon, everyone, and lovely to see each and every one of you again. Happy Africa Day to all the Africans and all the allies and all those showing solidarity with us. My name is Abigail Marshall-Katun, local councillor representing Little London Woodhouse and the city centre. I'm also the lead member for BAME on the council. And my other cap is I'm an athletics coach where I specialize in training under 15 girls in sprinting. So yes, this is our second session, which I've been called back on. So thank you very much to the Leeds African community for doing this, for all your hard work. To Kendi and the team, we're truly grateful for what you've been doing in the community, especially at this very difficult time of COVID-19. Lots of us on here, our lives will never be the same. A lot of people who have lost their lives to COVID. We pray that their souls continue to rest in perfect peace, and may our good Lord continue to comfort the hearts of all those who have lost loved ones. So I am pleased that we are having this so that we can continue to inform ourselves of the challenges that we have ahead of us, because we're not going to sit here and say it's all going to be rosy, but together we have been working hard to ensure that we are all looked after and we're properly informed. So thank you very much for inviting us again, and I hope we have a good time answering questions. So thank you.
And thank you to you, Councillor Abigail, and the Leeds City Council for supporting us. Thank you. And now Dr. Patricia Mbithe-Mutunga.
Hello, everybody. So my name is Patricia Mbithe-Mutunga. Most people know me as Mbithe, really. Patricia makes me feel a bit like an imposter. It's in my passport. So my job role, my role is I'm head of stem cells in Leeds. I work for NHS blood and transplant, which is sort of arm's length body of the NHS. Those who know what arm's length body means. So cover sort of Yorkshire up to sort of South Tyneside. We sometimes do cover James Cook Hospital. So all the hospitals in Yorkshire and South Yorkshire, and as well as Castle Hill, which is in Hull. So obviously stem cells and advanced cell therapy, and we are also involved in a lot of clinical trials, one of which is COVID-19 stem cell trial. It's not actually stem cells, it's advanced cell therapy. We are making some cells for a trial with a pharmaceutical called Realist. So that's ongoing. So I'm just here to really have a conversation with people. Maybe they can learn from what we are doing. Maybe I can learn from what they are doing. So this is a learning experience for all of us because COVID wasn't here last year. So we are learning as we go. But I think there is a lot of work that's being done. And sometimes instead of people reinventing the wheel, they can borrow from each other and learn what others are doing. Pick the good bits from everybody else. So thank you.
Okay, thank you. It's a bit echoey. Can you hear me?
Yes.
Is it okay? All right.
Yeah, so thank you. Thank you very much. So I'll just hand over to Lucy Ndlovu. Lucy is my co-host for today. And of course, we've got Sam Lee, who's our technical director behind the scenes, keeping us going. So I'll let Lucy take over now.
Okay, thank you, Kendi. And thank you everyone for joining us once again. I just want to give you a warm welcome this sunny Yorkshire afternoon. It's really nice here. You know, we were thinking who's gonna come, who's not gonna come, but we're so glad you've turned up. And you all look so beautiful in your lovely dresses. Xina, I must say, I love the yellow, you know, looking nice. Abigail, Marshall, Katun looking beautiful, obviously. And welcome, Patricia. It's really nice to have you. You were not here last time as a participant, but we know what you have to tell us will be very, very valuable. So you're most welcome. So we'll go straight to the questions, and we'll have to keep time, okay, for this to be meaningful, for it to be a conversation where we can all benefit. I would ask you to keep your answers brief, concise, to the point. And without saying any more, I'm just going to start with the questions that I've got. In the background, Kendi will be looking at the questions coming in through the chat. And then once we've answered the questions, she will then interrupt me or just feed the questions to whoever is actually speaking. So my first question will go to Doc. I can't see him, but I'm sure he's there. And my first question that I've actually got here is to do with, we've heard a lot about PPE and the fact that medical staff from BAME backgrounds did not have access to the correct PPE to start with. And that has been the reason why there's been a lot of deaths. Is it something you've experienced? Is it something you're aware of? Do you think that has improved? When you're talking about PPE as well, could you also discuss about masks? Because there's a lot of information going around that the masks sometimes are not as effective, they interfere with your breathing. Is it just a rumor, or is it something that do you have any backup, medical backup to go with that? Thank you. Over to you.
Okay. Thank you very much, Lucy, for that question. I think that's a very, very pertinent question, especially, you know, when COVID started. I think even the government, you know, they were quite a bit apprehensive, you know, about the availability of PPE, you know, because they didn't, you know, envisage that this was going to happen. So, you know, there wasn't that stockpile of PPE for an epidemic of this proportion. So I think initially, yes, there were issues about PPE, but from my own experience, you know, from my place of work, personally, I was never in a position where I could not find the right PPE for what I needed. Right? But I suppose, the reason for that could just be because, you see, I worked right at the, if you like, at the severe end of the scale, where, people were actually in intensive care and intubated. So probably maybe, most of the PPE would be directed there and would always be available. But I know that certainly on the wards, on the general wards, there were some issues with PPE initially. And so, yes, people were then advised that, they needed to use, like, if you like, a lower standard of PPE because there wasn't, that protect, the higher standard. So by this, I'm talking about, so it's mainly about the mask, which type of mask, because there are two types. So there is the normal one that you just see people wearing about. So we call that just a simple mask, or the one in a hospital, you'll find that it's actually fluid resistant. So they are slightly different. And then the FFP3 mask. So what people need to understand here is that the simple mask, so does not protect you, right? It is there to protect others. So it is there to protect the public, right? Because it catches your droplets so that they don't go out. So if you have COVID, then it works, right? But if somebody else has COVID, it doesn't protect you. So it's not that the mask doesn't work, but it is not designed to work that way. But if you have an FFP3 mask, so that should protect you and others. Now I have to to stress this point here is that if you want it to protect you, so it has to fit you tightly, right? So if you just wear it as a normal mask and you have gaps around it, then it will not help work, right? So it will fail. One thing that needs to be done if you are going to use it is that you need to be fit tested for it. So there is like a formal assessment of how it fits on you. Then you know that a certain type of mask will fit you, because there are different types of them and they will fit different people in different ways. Okay. So if you have all that done, then the mask should protect you. But so I suppose maybe that's what people are referring to when they're saying that the masks don't work or there are problems with them. Yeah, you really have to make sure that it is the right one for you.
Okay, thank you for that. Now moving on to the next question. This is to do with risk assessments. So the next question is probably best for, I guess, between yourself and Patricia. If I can just have Patricia on this one. And I know she talked about risk assessments last time, but we didn't really get into details about it. So Patricia, if you could just discuss a little bit about the risk assessments that you've been doing. Tell us a little bit about the process of the risk assessment for the medical staff. Thank you.
Yeah, so I mean, like most of you know, risk assessments are part of health and safety and health and well-being anyway, and should be done in every place of work. So once an issue or a hazard is identified, it's a legal requirement for the employer to do a risk assessment. And this one has been identified as an issue that they are more prone, or they are more susceptible to morbidity as well as mortality of this disease. So it's something that employers are required to do a risk assessment on. Now, I can only talk about my where I work, but I know because it's a legal requirement, this should be done in every place of work. So most people, if they do not know if they have a risk assessment in place for this to take place, they need to consult their HR, they need to consult their health and safety departments. So why are we doing risk assessments, or why have they been told to be done? In the NHS, I know most places have been told for every BAME there needs to be a risk assessment. We know there's a lot happening in the strategic level for people to review why this is happening. Why are we more affected by COVID? And that is a strategic level, and at that level, they want to look at solutions, long-term solutions. They want to look at short-term solutions, medium-term, as well as long-term, because long-term solutions are very important. But what we need to do now, there are things we can do now to help people not be exposed to COVID. And one of these things is just by carrying out a simple risk assessment. And what we've been doing where I work, and I've carried a few of these ones to the BAME reports, people who report to me. What are we doing? It's just having that one-to-one conversation with this person. Obviously, from the beginning, tell them why you are doing it, because it's always good to tell people why you're doing something. Always start with the why, I say. And once they understand you need to do this, tell them how this is going to be done. So you must have a process. I designed my own questions based on what the risk. There was like a national risk assessment. From that national risk assessment, I came up with my own questions tailored towards each person. And I'll just share some of these questions. What I started with is just asking somebody to be honest with me and tell me, do you have any underlying conditions which maybe you've never shared with anybody else, which are only known to yourself? And you'll be surprised that there are people with underlying conditions who have never really shared with other people that they have these conditions. And for example, I'm just giving an example. Somebody saying, actually, I sort of diagnosed as diabetic. And although I controlled it, now that already rings bells to you that that person is actually susceptible. So it's having those conversations and somebody telling you what vulnerable conditions they may have, what additional factors they may have that can pose a risk to this disease. And as with most risk assessments, you have to record this. It has to be on record. It can't be just a one-to-one conversation where you're not recording this. You have to record what the outcome is. And once you know if there are any conditions, then you have to, or if that person is not clear, then the next thing is to tell them, can you actually make sure this is checked? There is one person I told them, okay, can you get your blood samples done as soon as possible? Because we need to know. So by doing this, you come up with actions. Another question is, following all this, do you need adjustments? For example, a lady I didn't know she was pregnant, but she's also a minority. That already is a double whammy. So by doing this risk assessment, you put measures in place to make sure that she's not frontline. And that means you have to talk to other people and tell them, this person is not going to be coming into contact with any samples or things like those which may transmit COVID to them. And it's just by putting measures in place like those, also asking, by doing risk assessment, for example, in hospitals and even people like us who sort of procure stem cells from ill patients, from donors in hospitals. If you've got people who are public facing, and those people happen to be from the BAME community, and if those people have any underlying conditions or they've got any factors which make them more susceptible to get COVID, it's putting measures in place and making sure that those people are removed from frontline. They can be removed from frontline. They can do desk work. We've got people working from home. You can agree that this person is going to work from home from today because they need to be protected, and just make sure that organized for home working, they can access everything from home. and you just ensure that they've got enough to do from work. They can do documents, they can do paperwork, they can do a lot of other stuff from home. Again, is checking about just well-being, because one of the issues of COVID is not just the physical illness, it's the mental well-being. So during this time, there's a lot of people who've got anxiety, the mental health needs support. And it's actually been identified that one of the long-term effects of COVID will be just the mental issues because of what people have gone through. And it's having these conversations with people to make sure that they're mentally okay, that if they've got any anxieties, they talk to you about it, and you can refer them to occupational health, you can refer them to, we've got employment assistant programs, people, therapists who can talk to people, and it's having that conversation, and then you can refer them to these people.
Okay,
Obviously,
I might have to cut you short a little bit, but thank you for that. Leading on to that, we will probably come back there. I've been seeing questions coming in the chat, so there will be many, many more. Because risk assessment is something I can't recall having to have it done at work. So I think it's something that we are all aware of.
that's fine.
And it should be done. I agree, it should be done. So my next question now, leading on to that. So obviously leadership is a big thing. Leading on to that, my next question would be to Abigail Mashokatun. When it comes to the leadership side of things, I mean, what I'll do is I'll tie in the risk assessment that we've just heard about from Patricia and talk about, she did say that it's a legal right. So now we've got the issue of going back to school soon, 1st of June. We've got BAME teachers in the school saying, I might not want to go back because of these issues. Is it something you've come across? I know it's something you're looking into, schools opening in Leeds. If you could talk to us a little bit about that. And also maybe on a little bit about the risk assessment and any support that the teachers will be getting and the parents about this thing.
All right, thank you very much, Lucy. Yes, regarding the 1st of June announcement made by the Prime Minister for schools to be open by the 1st of June, I would like you all to note that schools have actually been open since March. So schools have been, we've got teachers still teaching vulnerable children and children of key workers. So school has always been open. So that's on one side. Now, in terms of schools opening for 1st of June and the stance in which the council has taken, I don't know if some of you have seen the statement by the executive member for Employment Skills and Learning, Jonathan Pryor, who was on the BBC last week, and what that said, until each and every individual school in Leeds has carried out their risk assessment and feels that it is very safe for children to return to school, that school will not open. As much as we want children to go back to school, we cannot force any school to open without the school feeling that they are safe enough for that to happen. Now, yes, there are risk assessments that each and every individual school is going through right now. We cannot put a blanket cover on each school and saying all of them open at the same time, because every school's resources and capacity is very different. So the council has been having meetings with head teachers. Officers in the council have been meeting, attached to every single individual school in the city. They've been having meetings with school governors and also unions. So based on all the different meetings we have been having, we have come to the conclusion that unless that individual school feels safe, they do not need to open. Now, what we're also saying, obviously, because every school's risk assessment will be different, and we have lots of BAME teachers who work in schools. We have lots of BAME people who are cleaners, who do lots of stuff in school. So all of those people have to be risk assessed before any individual school can as certain that it is safe for children to go back. We're also saying to parents, because we did my ward, which is Little London and Woodhouse ward, there was a survey that went out and we were asking parents, do you think it's safe for children to return to school? We had a 67.75% return saying no. You know, we asked them questions on why they think it's not safe and all of that stuff. So you see, for children, for parents to actually feel comfortable, head teachers and the council, we need to be able to assure parents that it is safe. But once we have gotten the information from the schools that they don't feel it is safe, we cannot force them to open schools. So that's kind of the stance that we're taking at the moment. I don't know, Hannah, if you're on there, if Hannah can actually just help as well in terms of the details for risk assessment, because Hannah is also a high school teacher, and I believe, Hannah, you specialize in geography. So if you could just help me there, that would be very helpful. Thank you.
Sam, could you?
Hi there. Yeah, I think you've really effectively covered the council's position. One of the other things that I do, which might be useful in this, is I'm on the exec for the teaching union NASUWT in Bradford. So in terms of BAME staff, I haven't actually had any staff come to or heard of any staff coming to the union in Bradford rather than Leeds, because I guess it would be a conflict of interest in Leeds coming to the union about it. But what I will do is make sure that it's brought up both in Leeds and in Bradford to discuss this as an issue, and make sure that we have a really clear stance that if a BAME member of staff is not comfortable that they are safe, then they have the union's absolute and total full support not to attend. That's the same with parents with kids. It's the same with the heads opening the schools more generally. If people don't feel safe, they do not have to attend.
Okay, thank you, Hannah. Thank you for that, and thank you, Abigail. The next question now will be to Xina. Xina, you had COVID. Unfortunately, you've gone through it, and your family has gone through it. Now, if you could just tell us a little bit on reflection, what do you know now that you wish you'd known then, as someone who's gone through it? And also talk a little bit about how that's changed you, and also, I guess, your profession as well. Thank you.
Okay, in terms of what I wish I'd known then, there isn't anything that comes to mind. I'll be perfectly honest with you. We were kind of clued up about it because we had one of our sons doing his year out in China, and so we were probably amongst the first families in this country to be made aware that there was a dangerous virus in China that no one had heard of before. So we kind of knew that it was dangerous. We knew that it was contagious. We knew that we needed to be quite careful about it. There's nothing I can think of. Like a lot of people in my circles, we wash our hands regularly as standard, and that's probably maybe a little bit more than the average person because of the line of work that we have. But we were always hand washers anyway. I honestly cannot think of any other preventative measures that I could have taken. In terms of how it affected me, I think we've probably got a few different approaches to how to deal with sickness in the household now, because myself and my husband are seen as invincible here. So people didn't realise we were as ill as we actually were. And I was too ill to be discussing or having a conversation about how I was feeling with anybody. That there were other adults in the house, there are other adults in the house. They were self-isolating and thought it would be just like a bad cold for us. And we weren't communicating. I'm not really one to discuss how I'm feeling when I'm poorly. I do just take myself off to my bed and don't really talk much. That didn't change when I was ill. If I was so ill next time, I would write a big note if I had the strength, and put it somewhere, or put it in a home WhatsApp group or something that you guys need to take really good care of us now, immediately. And this is not a discussion, it's not a conversation we're having, it's a direct order from a parent. I'd be quite firm about it, I think. In terms of how it affected the business, whilst I was ill, I was still working, doing little things because I couldn't really do much. What I was trying to do was ascertain from my professional body, which is the National Association of Funeral Directors, or the NAFD, as well as Leeds City Council and suppliers and other funeral directors, where can we get PPE? And that was a real battle, and we only got PPE last week. And that we've been trying to get it since March. We contacted the council, we'd contacted the NFD, there's somebody called the West Yorkshire Response Forum, I think it's called the Emergency Response Forum. They were involved in the loop. We didn't really understand what their role was. But I was trying to engage with people to make sure that I could keep my team safe and to keep the families that we serve safe. I had an understanding of what this illness was like. I could understand why somebody frail would die from it, and there's no question about that. I did not want to spread this, and I didn't want my team to get it. I didn't want the people who were supposed to be helping to get this because of us and because we didn't have PPE. So yeah, that was really, really hard.
Can I ask, yeah, I'm sorry about that. Can I ask where you got the PPE from? Did you have to go buy it? Or?
No, we tried to buy it. We were told that we wouldn't be able to get face masks until September, and that included, we were trying to even get Force 10s. Force 10s are the things that completely cover your face and have two holes there. They don't look quite as scary as gas masks, but they're a variation on that theme. Right. And our thing was, if we get that, then all of the filters should last 30 days. So we're not having to chuck them away, and then look for more. We should be safe for 30 days at a time. Each person can have one each. That particular supplier is a manufacturing supplier. We still have no Force 10s from them. They still have no date as to when they're going to be ready, and they told us that the FFP3 masks would be coming in September, so they were useless. We ended up getting them via the West Yorkshire Resilience Forum, and we'd already spoken to them early on and were told that we needed to speak to the council. We were passed around. It was too problematic, and that system did not work for us.
Right, so PPE is still an issue then, from where you stand?
At the moment, no.
It's not at the moment.
No, because they've finally responded to us now and helping us now, but they could have done that 2 months ago, is what I'm saying.
Right, okay. Thank you, Xina. Thank you for being honest about it. And we are glad you're well and your family is well. So I'll just check with Kendi if there's any more questions.
Yeah, so we've got a few follow-up questions. So I think I'll go back to Councillor Abigail Marshall. I think there are quite a number of questions around schools. So you said that we can risk assess. The schools have been asked to risk assess and to say whether they feel that they are safe to open. The question that's coming through is, what if we as parents feel that we don't want to take our children back to school? We don't feel safe enough, and especially parents of children from BAME communities. Would it be okay for us to choose not to take our children back to school?
Yes, doctor. You do not have to take your child to school if you do not feel that it's safe for your child to go to school, and you will not be penalized by the school or the council if you do not feel safe to take your child or children to school.
So how do people then just evidence that? Do you just say that I don't feel safe and that's enough, or do you need to give a little bit more of a narrative to the school to support your decision?
Well, I think that will be down to each individual school. I cannot speak for what a school will want to get from the parent in terms of the reason, because even the resumption of schools, from what some of the teachers are planning at the moment, is going to be staggered. So maybe some would have 2 days in the morning. So it's not going to be like a full 5-day return. So those are all the different ways that different schools are looking into opening. I mean, you can imagine how difficult that is, because if people are social distancing and doing 2 meters, if you have 30 in one class, you're going to be able to, with social distancing and the 2 meters, you're looking about 6 to 5 children in one class. So how many classes are you going to have in the school that is just going to be enough for just the one class? So you can see all these things will have to be put in place. And that's the reality that we are seeing, that it's not real. And that's why we're saying, you know what, it's up to every individual school. If it's not practical, if you can see that that is not going to work, where children can be safely distant. I mean, I'm still struggling with how you tell a 7 or 6-year-old in year 1 about social distancing, and when they go to the playground, all children know how to do is play with each other, and touching is part of their play. How do you tell them that when you're in the playground, you can't touch, you're self-distancing? So these are some of the questions that we as a local authority have actually asked the government, asked the central government, and we've still not received answers for them. But anyway, we had Boris Johnson last week told us that he believes that head teachers will make the right decision. So now again, it's gone back to the head teachers to be the ones to be able to sort out what they are telling people to do in terms of resuming on the 1st of June. So if any parent is not comfortable, you do not need to take your children to school.
Right. So this one, I'll just to follow up on that, and then maybe Doctor can also, Dr. Chinyandura can also add to this one. So do you think then that children, so the opposite could be that Black parents or parents of BAME and Black children in particular may want to take their children into school. Do you think those children should be risk assessed? And yeah, I'll let you answer that, then I'll ask the second part of the question to Doc.
I am not certain. I've not seen the different questions in terms of the risk assessments for children. What they're concentrating on at the moment is the risk assessment for teachers and for how they want the technical arrangement for the schools. Obviously, we have children who are also vulnerable and also susceptible to COVID in terms of we know children who are asthmatic. You know, there are different underlying sicknesses with different children. So these are all the different things that the risk assessment for schools will have to be taken care of. In fact, whilst we were speaking, I've just sent a message trying to see if I can get a few specific questions in terms of the risk assessments on returning to school, and then I'll share with all of us before we finish this evening. So once I get that, I'll be able to share that with you. But until then, I do not want to say anything that I am not very certain of. So please bear with me.
No problem. Thank you. So I'm going to ask.
I'm sorry, I can actually, Hannah can actually give a few more details on the specific risk assessments, because obviously, as a teacher, she would have some of those things that she actually uses to be able to guide us as well.
Okay, Hannah.
Thank you.
Thank you. Yeah, in terms of the risk assessments, I just thought it might be beneficial for you guys to know the process the schools have been through. So there is a multi-page risk assessment form, which is just a list of all of the different things that need to have their risk checked, and then how you're going to mitigate those risks. That has to be done by the head and their senior leadership team. It then has to be checked by governors, and they check that they're happy with it. A lot of us councillors, for example, are governors. And then the local authority also then goes in and does a supportive conversation around the risk assessment. But as has been said previously, if you're not comfortable with your kids going in, don't send them. One thing that's probably worth noting is that children, quite a lot of children, generally will also have risk assessments done on them individually as students. That's quite part of the course for teaching. Now, I don't know whether anyone has necessarily thought of doing it specifically around COVID and specifically around BAME kids, but actually I think that's something that both me and Abby could definitely take back as something that it would be sensible to suggest to schools to start potentially thinking of, if that's something as a group you'd like us to take back.
Fantastic. Thank you very much. So, Dr. Mathias, maybe you could help to give some clarity there, because do you feel with all this, we've been saying that BAME communities are susceptible, but we haven't really been talking about children. So do we think that Black children are at higher risk, and therefore should they be specifically risk assessed from a medical perspective?
Thank you, Dr. Kendi. So in general, so we know that children in general, they are at very low risk of getting a COVID infection and also getting severe COVID disease. But what we also know is when you compare the different ethnicities, so Blacks and Asian minority, so they are up to 4 times at greater risk. So that probably will translate as well to the children, but we don't really know, right? But then the important thing here to think about then is that, well, so if children are at very low risk, even though, they are more at risk, but then that risk is still very low, does that then amount to us, having to put in these extreme measures, because remember, what you're then going to do is that, you're going to say, oh, okay, we've got a child who is BAME and they have asthma. So what are we going to do? Are we then going to teach them on their own? Are we going to restrict what they can do? And that will then put them at a disadvantage in school, because everybody else is now, in school and progressing, as normal, and then they will have restrictions put on them, which you can't really put a time on, because their asthma is not going to go away very quickly. What do you have to do? So I suppose these are things that we don't really have answers for at the moment, and maybe the government review that's going on, I'm not sure if it's going to look at children specifically, but I think that maybe this might need to be looked at as well, to say that yes, we need to be doing something for them.
Fabulous. So Hannah, I think that the answer is yes. We need you to take that back and say, can we please do something? Thank you very much. And carrying on that trajectory, we had a comment from Claude Hendrickson, who's the BAME officer for Leeds Northeast CLP, and he was talking about, his comment was around evidence, I think, sort of like collecting evidence and workers having to take pictures maybe, as evidence around risk assessment. So I'll ask Dr. Mutunga to take this one. So you talked about all the risk assessment that's being done. The question is, it's one thing for people to say, yes, it is there and you can take it, but what is the uptake? Are people reluctant? Because sometimes people feel that it might be punitive, they might lose their job or something like that. So are you experiencing any of that? And do people need to, for instance, outside the NHS where it's obvious maybe, but in other spaces, in other places of work, do people need to gather evidence to try and make a case for why they believe they should be risk assessed?
I think most people really want to. Talking about my organization, it's been the uptake. They are still going on, so they've been a bit slow. And I think one of the reasons why they're being slow is actually the managers. Managers have not initiated this to happen. And one thing I'm telling people is, if your manager has not initiated this, because it was classed as an urgent medical thing, really, for people to get risk assessed. If they've not initiated that, then that person can actually request to talk to the manager and say, I have not had this done yet. So, and I think that's one of the things which people dialed to the talk about going beyond statistics is having a voice. Really, you've got to voice your concerns, because if you do not voice them, then it may be quite costly. And sometimes people, when it comes to BAME issues, sometimes people don't know how to handle BAME issues. And I think that's clear in most organizations, that people who are BAME sometimes feel like they shouldn't be pushing for these things. And then those who are not BAME and who are supposed to push for these things, they sometimes feel they don't know whether they're doing the right thing. So there is always some of these unknown issues which crop up. And something else that's come up actually in my organization is that this name BAME is, and that's another story, because there are people who do not identify themselves as BAME in the employment records, for the simple reason that there's a lot of people who don't want to be color-coded. I mean, we say Black Asian. Why are we not African Asian? But like I say, that's a debate of another time. And so there are people who've not identified themselves as BAME, and they may be missed because everybody who is a BAME got an email telling them what they need to do. But this is being, the whole country, because we are everywhere in England, everybody is being told this needs to be done. But what you are doing, once you do the risk assessment, you're actually logging in through the system. So HR is collating all the information. They are looking at all the issues, making sure that they are mitigating factors. Something has been done to make sure that those risks are reduced or removed.
Yeah, okay, that's great. So the message is that people should not be afraid. They should push for this. It's their right, and they are protected. Yes.
Yeah.
So a sort of linked question. There was a lot of talk about testing in Africa and people up in arms when it came to COVID-19. And so the question that we have received is to ask, why do Africans not take part in clinical trials? What needs to be done to encourage their participation? And I imagine right now this would be critical, because we need to make sure whatever that is developed as a solution to this pandemic is effective for us. But if we are not participating in the trials, how do we do that?
Is that to me as well? Yeah.
Yes.
Okay. That's true. That's true. I mean, I've worked in solid organ transplant. So I was in solid organ transplants before, kidneys, hearts, and name it. And I am also a donor ambassador. So I do promote, especially BAMEs, to donate organs, stem cells, because it's our culture. There is always, I don't know what to say. There's a lot of issues and they're very complex. And I don't want to give a simple answer to a very complex thing. Because of our culture, we've always not been very ready to take on things like donate organs, donate stem cells, also to participate in research and clinical trials. But at the minute, I think, because I'm involved in other clinical trials, not just for COVID, things to do with leukemias and with all these new cells called CAR T cells. I think now there is quite an uptake. And why most people do not take on these clinical trials, one of the issues, I'm just talking about one of the issues, is they're not explained to them fully. If people are told about something in a proper way and in a detailed way, told how it will benefit them, what the risks are, what the potential benefits are, most people will take on these things. So again, it comes to a lot of culture issues, communication issues, when people are not explained about something properly.
Fantastic. So I think we should be encouraging each other to participate and try and get as much information as we can, right? Yeah.
Oh,
Okay.
yeah.
Fantastic, great. And then to just shift the gear a little bit, I'll go back to Dr. Mathias. And this question is about why Black people in Africa do not seem to be getting COVID at the same rate as those in Europe and in the UK in particular. So this person sort of cheekily asked, does it mean that actually the medical, the social, and all of those structures are better in Africa than they are in Europe? Is that what's going on? Or basically, what are the reasons? And related to that, I will just read a question that came in from our Vice President, Mr. Abdul Rashid Thomas. Bear with me. He says, President Trump has said he is using the drug hydrochloroquine to prevent COVID-19. Are the most ill patients in our intensive care units being given hydrochloroquine? And he went on to say, and could it be that because we use this in Africa quite often for malaria, so we are kind of resistant in Africa to COVID-19? So over to you.
Thank you, Dr. Kendi. I think I'll start with the hydroxychloroquine question. And yes, President Trump, has come out to say he is taking it. And, I can only, imagine the impact that has, because obviously it immediately sort of implies that everyone should be on this drug. But that drug there has been a trial on hydroxychloroquine in COVID, right? And that trial, the outcomes were not supportive of using hydroxychloroquine. There were no differences between the two groups, and it has quite a lot of side effects when you have to take it that way, for COVID. Yes, the drug is used for malaria. It is used, I think, for people with arthritis, and then they take it. But for COVID, there is just no evidence to support its use. Then coming on to the question about Africa and COVID, I think it is very, very apparent that Africa is not the epidemic in Africa is far much less than in the European countries. I'm not sure why that is, but what we are talking about with BAME, right, is basically it's a comparison, between the white ethnic groups and BAME. So in Africa, I think maybe apart from South Africa, most of the African countries have got very, very sort of small populations of white people. So what would be interesting would be if data can come out of South Africa to show that same comparison, so then that would support that, there is a difference, between Black people and the white people, which is apparent here. As to, why the epidemic is lower in Africa, I would be just speculating. I mean, I'm not a public health expert, but I suppose, it could just be that, COVID or SARS-CoV-2 is a virus that is seasonal. In Europe at the moment, or certain, when the epidemic started, we were like, in winter, and in Africa, certainly like Southern Africa, it's very hot. So maybe those are some of the issues. But I don't know. I would be circulating, but I'm sure, you know, somebody somewhere will come up with the data to try and explain all these things. Yeah.
Great. So basically, the long and the short of it, it's quite anecdotal right now, and it's very difficult to draw conclusions until we know a little bit more about what's going on. Thank you for that. Now, I'll go over to Xina. End of life is not something that we like to talk about a lot in the African context, as we've said before. However, it is something that we are having to look at quite closely and consider the options that are available to us, because as you have heard, cases are more prevalent amongst Black people or people of African descent, and therefore this is something that they have to engage with more perhaps than other communities. So my question to Xina, since we had you last time on here, we think there are, you know, we are aware that there have been some changes to the rules and regulations around end of life, funeral arrangements and bereavement. So can you please share with us what's going on in that end?
Yes. Yes, thank you. I think the main difference is the reduction of the amount of people who can attend services. So we know that at the moment we cannot gather in places of worship to do our usual goodbye service. We cannot attend at crematoria anymore. I think Leeds City Council are changing that, and in June, I believe up to 10 people will be able to participate at the crematoria, the Leeds crematoria. In Wakefield, they've already been able to have 10 people attend for a little while now. At the graveside, it used to be that 20 people could attend. Now it's been reduced to 10. I am not aware that Boris has said anything to change that kind of gathering those amounts at the graveside. What I said last time, and I'll reiterate again, is that although African people, European people, irrespective of race, we all grieve. How we deal with that grief can be very different depending on our culture. And as African people, culturally, what we would need to do is have contact with our loved ones, whether they are alive or dead. We don't have the earth factor. I'm not going to go and see a dead body, because to us, it's not a dead body, it's our loved one. That love does not switch off because their life force has left their physical body. We still have an attachment, a very real attachment to that body. So for us, there is a need, and that is a part of our grieving process. And I believe that these changes will have a more acute impact on African people because of the way that we engage in the grieving process through contact with each other. I said before that our funerals are, you know, as standard, they are highly populated. It's the norm for us to take time off work for funerals. That's not really a big deal for us. We will, as standard, have upwards of 200 people attending at funerals normally, and that's in addition to the family. And the family can be large as well. So when you have a large family, say there's 10 adult siblings from the ages of 30 upwards, well, we know that they're probably going to have children and maybe even grandchildren too. How then are they supposed to decide which 10 people are going to attend at the graveside? That again could compound the grieving process. What I touched upon before, and what I really think is so important for us as a people to hear and to give us some kind of power in a situation that, through no fault of our own, can leave us even more severely bereft, if that's even possible, is for us to consider thinking forward about how we can celebrate that person if we are not able to celebrate that person at the moment in the way that we would like, or in a way that we see fit for that loved one. and that can help us, that can empower us and give us a hope in a situation which might otherwise seem quite hopeless and devoid of hope, and compounding the sense of loss. So whether it's thinking about having a memorial service later on in the day in church, or the mosque, or wherever your place of worship might be, whether it's having a large family gathering and thinking about taking time, to select pictures and photographs and discuss memories, favorite memories, perhaps even recording messages of loving engagement with the person who has died, and compiling things, being able to take advantage of the time that we have in lockdown and use it to our advantage. So compiling videos, compiling photo mosaics, getting children to draw pictures, thinking of different tributes, everybody compiling written memories, creating a book about that person from each person's perspective. And I'm talking about having really, really calling on our artistic and creative selves to put together something that is filled with love, impacting, and will even be something we can hand down to our descendants and say, look, this is what we created because your great-great-grandmother passed away during lockdown, but this is how we chose to celebrate her. And it can be something that, becomes an heirloom. I think we have to think about ways of empowering ourselves, which helps us in the grieving process, because otherwise I think we are going to have mental health issues on top of our bereavement process because of how we deal with death culturally.
Okay. Thank you, Xina. Thank you so much for that. I think for me, I guess the question would be leading on to that, again, is to you, is to ask you what kind of support is out there for people who are grieving right now. They're grieving differently. What kind of support has that's been open now that maybe probably never existed? There's a lot of online memorials and things like that. But what kind of support do you know from your profession that people need to tap into? We now know more people this is something we're having to talk about more with our children and our families because of it's in the news every day. So if we just briefly tell us that.
Yeah, surely there are things that we've had in place for a few years now that have actually come to the fore in terms of the importance because of lockdown. We've always promoted funeral planning and paying upfront. I know somebody mentioned earlier on in the thread, are we going to have fundraisers for Black people who have passed away during COVID? That certainly would not be within our remit. That would, as funeral directors, our first priority is towards the clients and client care during bereavement. But we've always promoted the importance of planning for funerals. So that's one thing that's coming to the fore now. Another thing is live streaming from the graveside and from the crematoria. We've been able to do filming for years. We've done photography for years. Those things I think are now more coming to the fore. We have had online obituaries for years, but that again has come right to the fore, and there's no charge for those things. And we've got our Facebook group, which is alive, and people regularly participate on it, and they're able to share their thoughts and feelings about people who have died. And again, that has come to the fore because people can use that on Facebook if they have friends and family on Facebook, and then they've got the obituary page on our website that they can share internationally, whether those friends and family members have a Facebook account or not, they are still included. So there are certain things that we have provided consistently, but we know that there's a bigger demand for those things, and it's clear to see why they've become more important now as people are looking at alternative ways to support themselves during lockdown when they're bereft. The other thing that I would say, I'm a big fan of staying in touch with your family members now. We don't know what it's going to happen tomorrow or the day after or next week or whatever. Myself and my family, we have WhatsApp groups. We've recently moved to having a Zoom meeting. Every month we had Family Day. I think I mentioned this to you guys before. The highlight of my month was getting together, cooking big food, and seeing all of my family in my home. Well, we can't do that now, so we've moved Family Day onto Zoom. Don't wait for, you know, to lose someone to say, I wish I'd been more in contact. We know that we are really busy. We're living in quite a busy society, even with lockdown. Find a way to stay in contact with your loved ones that suits your personality type. If you can't do the telephone, WhatsApp people. If you can't speak to lots of individuals, set up a group and stay in contact that way. If you haven't got time to type, do a video call and send it out to your loved ones. It's really important to keep up contact throughout lockdown because of our traditions. We can't neglect them because we can't go to people's houses. We'll have to find a different way of dealing with that. But certainly, yes, in terms of what we offer, it's certainly the streaming that has come to the fore and the online services that we've provided for a long time.
All right. Thank you. Thank you so much, Xina. Thank you.
You're welcome.
Thank you, Xina. Thank you. Beautifully said. And in fact, I can see that Sam has commented and said that he attended an online memorial recently where everyone shared their phone memories and the call was recorded, then shared with the family. And he says it was beautiful. So yes, there are solutions and interesting ways to try and adapt to what's happening adapt to what's happening at the current times. Now then, it's important for us to also think about the resilience part of things. We only have 10 minutes to go. And I want us to think about what are we going to leave this webinar with that makes us stronger. Xina has shared quite a lot about things that we could do to help us get through this. And I can see some coming up with a very practical one to thinking about your own life insurance. It's good to be prepared. I think John Ebo talked about what Xina has mentioned, maybe we should come up with a bereavement fund. So that is what perhaps a council can, like the city council can look into. But for us today who are here, what can we take away? So if any of our panelists or anybody who is a participant, put your hand up. If there's anything positive you want to say to us that will help us just go like, we can beat this thing, we can do this, we'll be good. Please, this is your time to share now. I think we had Dr. Felix Akande putting his hand up at some point. Sorry, Dad, I have to pull you in on this one.
Okay. Yes, are you hearing me?
Yes, we can.
Okay. Good afternoon, everyone. I think it's been a great meeting. I didn't attend the original meeting because it clashes with other program, but since it's a holiday today, I decided to jump in even at the last minute, and thank you that I've also accepted in. One of my thoughts initially, and what I put a private question, which probably didn't come to the fore on time, is the fact that the use of chloroquine products and hydroxychloroquine. By the way, I am a pharmacist myself, and I believe medicines should be used for the indications for which they are licensed for. There are times that medicines are used out of license, but it is a risk, and the risk is being taken by two people involved, the prescriber of that medicine and the person that agreed to take the medicine out of license. So at the present moment, hydroxychloroquine is one of the group of medicine they classify as disease-modified agents for rheumatoid arthritis. That is what is basically used for today. It's not even used for treatment of malaria at all. And even in Africa, at least I can say for sure of Nigeria, Nigeria has moved away from using chloroquine on a daily basis for treating malaria for over 10 years. So much so that it is actually in the black book of medicine not to be used. They use all this artemisinin and all these funny names now of medicines to treat malaria in Nigeria and by extension, most of Africa. And generally, it is not all the time. You can't see an African person just waking up one day and be taking chloroquine because we want to prevent malaria. What we do to prevent malaria is to make sure that we have our rooms all well netted, prevent mosquitoes from coming in, sleep in mosquito nets. Those are preventions. So to think that because the cases reported in Africa today are low is because people are already taking hydroxychloroquine. I want us to dissuade our mind from that. I don't think it is technically true. The other point that I would like to also mention is that with regard to schools, you see, there was a report that was brought in by Channel 4 when they were, is it either Channel 4 or ITV, thinking about the number of Black and ethnic minorities that have died, especially the professionals, and the many reasons people give for not speaking now. So when we talk of risk assessment, even if you have a problem, as a Black person, your fear is if you tell your management to risk assess you based on this, you might even be removed from that job. And your life and your presence in this place depend on that. So there are a lot of factors that are at play when you deal with our own people in this community. So it is how best we can manage it. And through the education this group is providing, it will help. If we have a way of disseminating all that we have said now to reach our different communities at different levels, we will have gained something from this meeting. So I think, yes, it is good to empower ourselves that you need to do this, you need to do this. People should have a forum to fall back to in case there's any backfire or people treat them differently because of volunteering their opinion, giving themselves an assessment on this. You can report back to the BME group in the council or this group which will take your case forward. So it's like we should find a way to serve as an advocate for our people. Thank you.
Fantastic. Thank you very much, Dr. Akande. So you can all go and say, no, we are not going to do what Trump has said because we have it from a PhD pharmacist that this is definitely the wrong thing to do, right? So that's one of the tips that we are taking today. So I'm just realizing we only have 4 minutes, how quickly 1.5 hours go. So I'll just summarize a little bit about some of the tips that we have collected from today. So we've heard from Xina about how it's important to stay connected, how it is important to take care of yourself, first and foremost. We've heard about risk assessment and how Councillor Abigail and Hannah have said that we also in schools, they're going to make sure that we are well prepared. The schools are well prepared for our children, and they have told us and reassured us as parents that ultimately we have a right to decide whether our children go to school or not. We've also had from Doc about all the things that are, Black people and why it is that we think, we are more susceptible. He's also told us a lot about PPE and how to use it correctly and whether you are protected or whether you are protecting other people. So we need to take that information and act accordingly from that information. I can also see that Hashim. So Hashim has been really active. So thanks for that, Hashim. And he says, don't suffer in silence. And honestly, I couldn't put it better. Don't suffer in silence. So even the tips that Dr. Mutunga has given us about risk assessment, you can hear that a lot of it is speak up, ask, it is your right. So information is power. Now, our vice president very cheekily asked me, so what are you and the Leeds African communities doing about this? He should know, he's part of us. But anyway, I will say as the president of the Leeds African Communities Network, part of this series of webinars is one of the ways that we want to reach people. That's why we record it and we share it. We want to make sure that people have the right information and we are signposting them to the right people. We are working very closely with the third sector and Leeds City Council to make sure that we are giving people the correct information. Yeah, so we are trying our best. And then I got a text being told you introduced everybody and did not introduce yourself. So for those who don't know me, I am Dr. Kendi Gwantai, and I am the president of the Leeds African Communities Network. So I want to thank you all for joining us. This has been amazing. I wish we had more time because we have a few more questions, but I hope you will all leave this feeling informed and empowered. So before we leave, we'll say, Sam, if you could put up that last slide, we'll give you a few of our contact details. Oh, Abigail had her hand up. Does Abigail want to say something quickly before we go? And Dr. Mathias as well, I think, had his hand up. Sam? Where are they? Abigail? No? Okay. Dr. Mathias?
No, I was waiting to be unmuted. Yeah, sorry,
okay,
just to add, in terms of the bereavement, just to help Xina with the questions and what the council stands in, you are allowed up to 10 people per family at the crematorium going forward, and that was from last week. Also, because previously people couldn't go in, but now you can have up to 10 per family. In terms of help from the council, if we have a resident from Leeds who actually passes away whilst at home, the council can actually help with funeral services and helping towards the cost of the funeral. If you die in hospital, the hospital will actually take care of all of that. So lots of people don't just get into a lot of stress without coming to ourselves to find out what the council can do for you. And for those of you who do not know currently in terms of what the government are providing, if you have anybody who works with, who's in the health sector, worked with the NHS and has passed away due to COVID, the family is entitled to some form of insurance compensation from the government for up to £60,000. We're also going through the process where their families are also given indefinite leave to remain if they're from ethnic minority and maybe just had a limited time on their residency. So there are lots of things in terms of funeral and bereavement services that the council has. So you just need to ask, and we are definitely there to help us. You have to remember we're doing everything that we can to be the best city to live in, and we are a city of compassion, you know, so come to us. Like what somebody said, that do not die on your own and do not be quiet and suffer in silence. Please do talk to us. There are lots of us that you can come. There's your local councillor. There are just whoever you can get in touch with to just let us know, and we will definitely do everything we can. Our resilience is amazing when it comes to doing what we have to do. I mean, we've been survivors. Every one of us here today have had it. We've come from far and have settled here as diasporians, you know, and each and every one of us have got our stories. But that resilience, where we face adversity with so much strength inside of us, please let's not give up and let's keep going. So thank you very much.
Fantastic. Oh, it's so important to have heard that. I know we are overrunning by a few minutes, but we did start a bit late, so I'll be a bit cheeky because we want to hear from Dr. Mathias as well. He's had his hand up. But I will say also point out that Peter Broderick, that Xina's husband, has just put something in the group chat, and he has said that there is a monthly online care cafe by the Coping with Bereavement Project. So that's Coping with Bereavement Project. So you can search on Facebook or call 0113-834-5141 for more details. So thank you, Peter, for that. So Dr. Mathias, then we close.
Thank you, Dr. Kendi. I just wanted to say, you know, that, you know, we need passion about this. We need involvement. And I was so glad on Friday evening, I was able to attend a webinar, right, on BAME issues, which was hosted by Xina Badawi. I think, you know, you probably all know her. I didn't know she was from the Sudan. So she hosted a webinar called BAME, Going Beyond the Statistics. And it actually had quite, a high-powered delegation with it, and they touched on a lot of issues. But the one thing that I took away from it, was the involvement of all the BAME organizations, and they actually contributed. So, rather than just having the panel, talking, they actually involved all these organizations, and they also gave their own views. And just to capture that, I actually had to take a screenshot of one of the comments, one of the participants in it, called Michelle. She was so passionate. She said, "I want to help Dr. Fenton and going forward, and I feel very, very passionate about this. How do I get on board?" So this is just a member of the public, appealing and just wanting to give more. And I think, that passion is what we need to have, to be able to win this war.
Yeah, fantastic. Thank you very much. A really good message for us to take home, and a powerful message to end on. So let us all be reminded by, that we share that African spirit of Ubuntu, where we recognize I am because you are, or because we are. We are a collective, we are interconnected, and if there is a time that we should draw together, it is now. And together we can beat this. As Councillor Abigail Marshall has said, we are resilient, we have fought so many things, and we are still here. So please, let's work together to help each other, to help our brothers and sisters as well. So thank you very, very much for joining us. If you are interested in the work that we are doing at the Leeds African Community Network, please do get in touch with us. Our email address is on the screen now. That's leedsafricancommunities@gmail.com. You can tweet us at Leeds African, and our phone number is on there. We also do have a COVID-19 community help and support GoFundMe page. The link is on the screen right now. We have been feeding our people who are less fortunate than us, and we rely on people such as yourselves, the generosity of people, rather, like yourselves, to give us in material, to give us in money as well. If you want to bring material stuff, please do get in contact with us. Again, we are looking for toiletries, tissue paper, cleaning stuff. We're looking for food, and especially African food. So if you have anything extra, please feel free to get in touch with us, and we'll be delighted to take it from you and give it to people who do not have. So thank you so much to our lovely panelists. Thank you for accepting this invitation. Thank you for standing up for us and with us, and thank you to all the participants for giving up the beautiful sunshine, sacrificing to come indoors rather than sit outdoors, apart from Hannah, who was clever enough to be able to sit out in her garden. So thank you so much to everybody, and enjoy the rest of the bank holiday and stay safe.
Thank you. Bye-bye.
Thank you.